Vitamins for cancer. What you need to know about nutrients, supplements, and recovery. Vitamins, minerals, essential fatty acids, and amino acids are critical components of nutrition, playing a vital role in energy production, immune function, and cellular repair. For individuals diagnosed with cancer, maintaining adequate levels of these nutrients is especially important. Overview. A balanced diet rich in fresh fruits and vegetables can help support your body during and after cancer treatment. However, cancer and its associated treatments, such as chemotherapy, radiation, or surgery, may affect your body's ability to absorb or utilize key nutrients. This can lead to deficiencies that contribute to fatigue, weakness, and delayed recovery. Key takeaways. Focus on consuming a well-balanced, nutrient-dense diet. Nutrient deficiencies can impair recovery and overall well-being. Always consult your medical team or a registered dietitian before taking any dietary supplements. What are essential nutrients? The best source of vitamins and minerals is a diverse, whole food diet. Key nutrients to focus on include vitamins A, C, D, and E, all of which play critical roles in immune support, cellular protection, and healing. Minerals, zinc, calcium, selenium, and magnesium, essential for metabolic function and bone health. Essential fats, help regulate inflammation and support brain and cellular function. Essential amino acids, including phenylalanine, valine, threonine, tryptophan, isoleucine, methionine, leucine, and lysine, all crucial for tissue repair and immune response. Plant compounds, phytonutrients such as carotenoids, flavonoids, and isoflavones, known for their antioxidant and anti-inflammatory properties. Nutritional support during cancer. Many patients experience changes in appetite, digestion, or nutrient absorption as a result of cancer or its treatments. These challenges can lead to specific nutrient deficiencies, even when eating regularly. In such cases, a healthcare provider may recommend nutritional supplements. These should always be used under the guidance of a medical professional to avoid potential interactions with cancer therapies or exceeding safe dosages. Why people with cancer use dietary supplements. Guidance on vitamins for cancer care. Dietary supplements, also known as nutritional supplements, are commonly used by people living with cancer to support their overall health. These may include individual vitamins, minerals, or multivitamin formulations designed to help address specific nutritional deficiencies during treatment. When are supplements recommended? Cancer and its treatments can affect how your body absorbs, stores, or utilizes essential nutrients. In certain cases, your healthcare provider may recommend dietary supplements to correct or prevent deficiencies. For example, hormone therapies used in breast or prostate cancer may lead to bone loss. In such cases, calcium and vitamin D are often prescribed to help protect bone health. If cancer affects the gastrointestinal system or impairs nutrient absorption, a daily multivitamin and mineral supplement may be necessary to help maintain adequate nutrient levels. Supplements as part of cancer treatment. Most patients take dietary supplements alongside conventional cancer treatments such as chemotherapy, radiation therapy, or immunotherapy. However, a small number of individuals may choose to use supplements in place of standard medical care. It's critical to understand that replacing evidence-based cancer treatments with dietary supplements can seriously compromise your health. Foregoing medical treatment may lower your chances of successfully treating or managing the disease. Potential risks and interactions. Before starting any vitamin or dietary supplement, always consult with your doctor, pharmacist, or dietitian. Some supplements may interact with chemotherapy or other cancer medications, reducing their effectiveness or increasing side effects. High doses of certain supplements may also be toxic or harmful, particularly during active cancer treatment. Choosing food over supplements. Whenever possible, prioritize a balanced and diverse diet to meet your nutritional needs. Whole foods offer a wide array of vitamins, minerals, and other beneficial compounds that supplements cannot fully replicate. How supplements are taken. Most vitamins and dietary supplements are available in pill, tablet, or liquid form. In some cases, complementary or alternative practitioners may use injectable forms of certain nutrients, although these should only be administered under medical supervision. Side effects and safety. What to know about vitamins for cancer. Vitamins and dietary supplements are often viewed as harmless additions to a wellness routine, but for individuals undergoing cancer treatment, they can have unintended effects. Understanding the risks, costs, and scientific limitations of these supplements is essential for safe use. Potential side effects and interactions. Some vitamins and minerals, especially in high doses, may interfere with the effectiveness of cancer treatments. For example, antioxidant supplements such as coenzyme Q10, selenium, and vitamins A, C, and E are known for their ability to protect cells from damage. However, during active cancer treatment, high-dose antioxidants may reduce the therapeutic impact of chemotherapy or radiation by protecting cancer cells from oxidative damage. This is why professional medical guidance is critical. If you are considering any type of supplement while undergoing cancer treatment, consult with your doctor, specialist nurse, or registered dietitian first. The cost of supplements. The cost of vitamins and dietary supplements can vary widely depending on the brand, formulation, and dosage. Many common supplements are available from health food stores or pharmacies for prices ranging from approximately £5 to £30. Others, particularly specialty or imported products, can be significantly more expensive. Before making any purchases, speak with your healthcare provider to ensure the product is appropriate and safe. What the evidence shows. Currently, there is no reliable scientific evidence that dietary or nutritional supplements can prevent, cure, or control cancer. While certain vitamins may support general health, none should be considered a replacement for conventional cancer therapies. Taking supplements without consulting your cancer care team could increase the risk of treatment complications or unintended side effects. Common supplements people ask about. Some of the most frequently discussed supplements among cancer patients include bromelain, selenium, vitamin C, vitamin D. While some of these compounds are being studied for potential health benefits, their role in cancer prevention or treatment remains unproven. Always discuss any supplement you're considering with your oncologist or a qualified dietitian to ensure safety and compatibility with your treatment plan. Bromelain and ESIAC. What you should know about these supplements and their role in cancer care. As interest in complementary therapies continues to grow, many cancer patients explore natural supplements like bromelain and ESIAC in hopes of improving outcomes or easing symptoms. While these substances have shown promise in early-stage research, it is critical to understand the current evidence and its limitations before use. Bromelain, a natural enzyme with emerging interest. Bromelain is a naturally occurring enzyme found in pineapples. It has been studied for its potential anti-inflammatory and anti-cancer effects, primarily in laboratory and animal research. Early studies have explored bromelain's impact on conditions such as skin and burn injuries, diarrhea, osteoarthritis, and osteoporosis. In preclinical studies, bromelain has demonstrated the ability to slow or inhibit cancer cell growth in certain models. It is also being examined for potential use alongside conventional cancer treatments to enhance therapeutic outcomes. However, these findings are preliminary. There is currently no conclusive clinical evidence to support the use of bromelain as a cancer treatment. Further high-quality human trials are necessary before bromelain can be considered safe and effective for this purpose. ESIAC, a popular herbal remedy with limited evidence. ESIAC is a traditional herbal formula that originated in Canada. It is typically prepared as a tea, though capsule and liquid drop forms are also available. A modified version, known as Floor Essence, is also on the market. ESIAC is often marketed with claims that it can cure or slow the progression of cancer, strengthen the immune system, improve overall well-being. Despite its popularity, multiple scientific reviews have concluded that ESIAC does not exhibit any anti-cancer effects. In fact, some users have reported side effects such as nausea, vomiting, and gastrointestinal discomfort. Additional adverse effects have also been documented. Laetrile and turmeric. Facts about these popular substances in cancer care. In the search for alternative or complementary treatments, Some individuals with cancer explore substances such as Laetrile and turmeric. While both are promoted for their potential health benefits, it's important to distinguish scientific evidence from unproven claims, especially when these products are marketed in connection with cancer. Laetrile, the misleading vitamin B17. Laetrile is a synthetic compound derived from amygdalin, a naturally occurring substance found in apricot kernels, bitter almonds, and some raw nuts. Despite being frequently marketed as vitamin B17, Laetrile is not a vitamin and has no established nutritional value. Supporters claim that Laetrile may boost energy and overall wellness, detoxify the body, extend life expectancy in people with cancer. When Laetrile is processed in the body, it releases cyanide, a highly toxic substance believed by some to kill cancer cells. However, there is no reliable clinical evidence that Laetrile or amygdalin can prevent or treat cancer. Major cancer organizations and regulatory bodies do not recommend its use. In fact, Laetrile has been linked to serious side effects, including cyanide poisoning and liver toxicity. Because of these risks, the sale and use of Laetrile is banned in countries such as the United Kingdom. Turmeric and curcumin, promising but still unproven. Turmeric is a widely used spice from the ginger family, most often recognized as a key component of curry powder. Its active ingredient, curcumin, has been the focus of numerous laboratory and early-phase clinical studies. In preclinical models, curcumin has demonstrated potential to kill cancer cells, inhibit tumor growth, reduce inflammation. Some small human trials have explored the role of curcumin in cancers such as colorectal and prostate cancer. However, the studies have been limited in scale and design, and as of now, there is no conclusive evidence that turmeric or curcumin can prevent or cure cancer in humans. In high amounts, turmeric may also lead to gastrointestinal side effects, including stomach pain or irritation. Soy, selenium, and vitamin C. The truth about these supplements and their role in cancer. Many individuals explore natural compounds and dietary supplements during cancer treatment in hopes of improving health outcomes. Among the most commonly discussed are soy, selenium, and vitamin C. While each of these has shown biological activity in research settings, the clinical evidence for their use in cancer prevention or treatment remains mixed or inconclusive. Soy and isoflavones. A complex relationship with cancer. Soy products contain compounds known as isoflavones, which are plant-based chemicals with a structure similar to the hormone estrogen. This similarity has raised concerns, particularly in hormone-sensitive cancers such as breast and prostate cancer, where estrogen is known to promote tumor growth. However, current research suggests that natural isoflavones found in soy foods are safe. In fact, early studies indicate that isoflavones may protect cells from cancer-related damage, reduce inflammation, enhance DNA repair mechanisms, lower the risk of cancer recurrence, particularly in breast and prostate cancer. These protective effects are believed to stem from the ability of isoflavones to bind to estrogen receptors, thereby blocking cancer cells from absorbing excess estrogen. However, most of the positive findings come from populations consuming high soy diets, such as in certain parts of Asia. Key consideration: while soy foods, e.g., tofu, soy milk, edamame, are considered safe and can serve as a healthy source of plant-based protein and fiber, soy supplements are not recommended for cancer prevention or treatment due to lack of supporting evidence and potential for hormonal interference. Selenium. A cautionary tale in cancer research. Selenium is a trace mineral with antioxidant properties. Early studies suggested a possible protective effect, including one clinical trial that linked selenium supplementation with reduced risk of prostate cancer in men with a history of non-melanoma skin cancer. However, subsequent systematic reviews and larger trials have failed to confirm these findings. In fact, some randomized controlled trials found that selenium supplementation may increase the risk of high-grade prostate cancer, elevate the risk of type 2 diabetes. Due to these inconsistent and sometimes concerning results, selenium supplements are not recommended for preventing or treating cancer. Vitamin C. Popular but unproven in cancer therapy. Vitamin C is widely taken in doses well above the recommended nutrient intake, RNI, of 40 milligrams per day. Some individuals also seek intravenous, vitamin C as a complementary therapy during chemotherapy. While vitamin C is essential for immune function and general health, there is no high-quality clinical evidence demonstrating that high-dose vitamin C improves chemotherapy outcomes or reduces its side effects. Potential side effects of excessive vitamin C intake include gastrointestinal discomfort, kidney stones, especially in individuals with a predisposition to them. Until more rigorous studies are available, vitamin C should not be used as a substitute or enhancement for cancer therapy. Vitamin D and cancer. What the research really says. The relationship between vitamin D and cancer has been the subject of ongoing scientific investigation. While vitamin D plays a crucial role in overall health, particularly in bone health, its potential in cancer prevention and recurrence is still being studied. What the research shows. Some early studies have observed a link between low levels of vitamin D and an increased risk of developing certain types of cancer. However, the evidence is not yet strong enough to support the use of vitamin D supplements as a strategy to prevent cancer or reduce the likelihood of recurrence. As a result, health professionals do not currently recommend vitamin D supplements solely for cancer prevention. Why vitamin D still matters. Despite the uncertainty surrounding its role in cancer, vitamin D remains vital for maintaining healthy bones. It assists the body in absorbing calcium, which is essential for bone strength and metabolic function. The primary source of vitamin D is sunlight, though smaller amounts are also found in dietary sources such as oily fish, fortified foods, and egg yolks. In the UK, public health guidelines recommend that all adults consider taking a daily supplement of 10 micrograms of vitamin D during autumn and winter when sunlight exposure is limited. Individuals at higher risk of vitamin D deficiency may be advised to take supplements year-round. If you're unsure whether you need a supplement, speak with your GP or healthcare team to assess your vitamin D levels and receive guidance tailored to your needs. Want to learn more about how vitamins affect cancer treatment and recovery? Subscribe to our channel and explore our other evidence-based health videos. Your health decisions deserve clarity. Start here.